This is my presentation. I will describe some examples of One Health in practice in Italy. Starting from the beginning, it was important to describe the peculiar health organization in Italy, in which veterinary services belong to the Ministry of Health. This is the organization at the Ministry of Health at the central level. As you can see, the two general direction on animal health and food safety belonging to the veterinary services. And this kind of organization is also in the same way at the regional level, at the local level, in which the veterinary services are within the prevention department together with the public health services. For sure, this kind of organization facilitates the interaction and the collaboration between the medical and the veterinary sectors. Um, Also, in Italy we have 10 istituti zooprofilattici sperimentali. They perform, they are the public laboratories, and they perform all the laboratory analysis for the veterinary services. I say that the collaboration between the medical and veterinary sector on a One Health perspective is has quite a long history. This is just an example. Since 2010, the two direction has issued an integrated surveillance plan for West Nile disease, on which the veterinary and the human and public health aspect are included. And since 2019, the national plan integrate all the activities of animals, human, and vectors. One big event that strengthen the collaboration occurred during the SARS-CoV-2 crisis. As you know, on February 2020, Italy was one of the first European countries facing the increase of SARS-CoV-2 infection cases. And the national health system was overwhelmed by the number of cases, and on the 8th of March of 2020, a national lockdown was declared all over the country. We can say that almost immediately on 16 March, the Ministry of Health appointed different zooprophylactic institutes, including my institute, to carry out to perform the PCR testing on the human swabs. For example, we performed this kind of activities for about 1 year and a half until the summer 2021. And during this period, almost around 665,000 swabs were processed. Just to give an idea about the importance and the huge activities that has been performed by veterinary laboratories supporting the human health and the public health institutions. Together with the laboratory testing, the genomic surveillance on SARS-CoV-2 was part of our activities, and now is still one of the important topic, an important aspect of the activities performed by our laboratories, with around 10,000 of samples sequenced and genetically characterized in our region. uh, I mean, following the uh, COVID-19 experience, uh, I mean, a stronger awareness about the need for a One Health approach remained. And as a consequence, we can say, um, of this understanding of the importance of a One Health approach, one example is the new national strategic plan for the preparedness response in case of pandemic influenza, in which the veterinary surveillance of avian flu and other cases of animal influenza are part of the preparedness, part of the surveillance put in place by the Minister of Health in order to be ready in case of any spillover to humans. Which are the next challenges that as a health system together, med and vet are trying to face in the future, we can say in the early future. One of the important challenge is related to the possibility to integrate the environmental health aspects into the One Health approach. One example of that is the application of the national plan for against the antimicrobial resistance in our region, in the Abruzzo region, in the central Italy. The regional program for the control antimicrobial resistance is putting together the veterinary experiences at the lab level, so the capacities for sequencing the bacteria and characterize from the genomic point of view the antimicrobial pattern of the bacteria, the capacities of the veterinary services in monitoring the antimicrobial resistance patterns in animals and especially in food producing animals, but also in pets, and the need of the hospitals, for example, and other health structure, and to be supported in the identification and the early identification of problems related to the antimicrobial resistance bacteria, and also integrating the activities made by the Regional Agency for Environmental Protection on water, on wastewater, on surface water, and in the environment in relation to the monitoring antimicrobial resistance. All the activities, all these structures has been coordinated and integrated all together in one single regional platform on which all the results on the outcomes of the different activities are integrated together. This is just an example of the point of sampling for the monitoring on waste and surface waters that will be used for the monitoring of the antimicrobial resistant bacteria in the environment. So, after these very quick examples, what we can conclude? We have to consider that human beings and animals, they share the same world, they share the same environment, and they influence each other. And therefore, any kind of preventive medicine must recognize the existence of this kind of very strong human-animal environment interdependency. So the environmental health is an essential part of the modern view of health. And that means also that local or national initiatives alone are not adequate to properly face the challenges and threats, and therefore cross-boundary solution must be pursued. And in my opinion, for an effective application of One Health approaches, personal and political attitudes must be in place. Personal, because the health professional must be able to go beyond their view and accept to be in some way, we can say, contaminated with our competencies. So the physician have to talk with veterinarians and vice versa, or have to talk with the biologists, environmental biologists, ecologists, and so on. Political attitude. Politically speaking, prevention must be a central topic of any health strategies. Trying to focus the health activities on prevention and abandoning the approaches based just on economical evaluation of interventions. My last message is that only One Health integrated approach can provide the information needed for a proper evaluation of assessment of risks, thus supporting the development of proper risk-based control and prevention policies. Thank you for the attention.